I'd like to call to order the regular meeting of the Medical Advisory Board of the New York State Athletic Commission. I'd like to first introduce the new members that are here today. Dr. Noble from Columbia, James Noble, Abika Nair from NYU, and David Angelillo from Long Island Orthopedic Spine. Maybe it might be worthwhile for everyone just to go around the room, introduce themselves, and just mention briefly what their areas of specialty are and their involvement in medicine or sports medicine. So you want to start?
So I'm Dr. Noble. I go by Jamie. I'm a neurologist at Columbia University. I've been there for about 11 years now. I'm specially trained in both general neurology and also Alzheimer's disease, and I lead a group of concussion care specialists at Columbia University, including the team physicians and care network that involves all of the Columbia University undergraduate athletes as well. So pleased to be here. Thanks for inviting me.
Dave Angelillo, orthopedic surgery. Been in practice now for about 4 years. I practice out in Suffolk County on Long Island. Did all my training here in New York. Did my residency at North Shore LIJ. Then I did a sports medicine fellowship at NYU, Hospital for Joint Diseases.
Russell Patterson. I'm a retired neurosurgeon. Was chief at New York Hospital Cornell for a while. And have been interested in boxing for many years.
Yeah, I'm Dr. Barry Jordan, Chief Medical Officer, New York State Athletic Commission, and a neurologist with special interest in sports neurology and Alzheimer's disease.
Jim Kinderneck. I'm at the primary care sports medicine. I'm at Hospital for Special Surgery. I am the director of the fellowship, primary care sports fellowship.
I'm Bika Nair. I'm a cardiologist at NYU. I'm mostly in the echo lab, and I have a small practice as well there.
Okay, and also want to acknowledge that on the phone we have Dr. Mark Mirabelli and Dr. Laszlo Metzler, members that are present from the New York State Department of State. That includes David Mossberg, Esquire, Melvina Lathan, chairperson of the New York State Athletic Commission, Edison Albans, and Laz Benitez. So the first order of business is the review of the minutes from the Medical Advisory Board meeting of January 16th, 2013. Is that everyone had a chance to look at the minutes? Any comments, discussion, changes? So can we have a motion to accept the minutes? And second?
Second.
All in favor?
Aye.
Any opposed? Okay. So let it be noted that the minutes were unanimously approved. The next order of business is to review applications of panel physicians. Since this information involves personal and specific information regarding a physician, we'll need a motion to go into executive session. Someone make a motion for us to go into executive session. Okay, second.
Second.
All in favor?
Aye.
All right.
Okay. Okay, we have returned from executive session, and the Medical Advisory Board has unanimously approved Dr. Robert Birnbaum to be a panel physician for the New York State Athletic Commission. The next order of business is a discussion regarding a mouthpiece that has an accelerometer. I will pass this around. For most of you probably know already, one of the areas of sports medicine, sports concussion, people have been interested in trying to understand what the forces are impacted upon the head. In particular, in football, they've been putting accelerometers in the helmets to get an idea of rotational and linear acceleration. Some investigators at Stanford sent me this mouthpiece. They were interested in actually trying to see if we can get some of the boxers to wear it so we can get a better understanding of what the forces were, forces involved with boxing. We can just pass it around and people look at it. It probably works on a telemetry system where the acceleration is transmitted to some type of device that records it.
There's a device currently being used, I believe it's either Notre Dame or Michigan, that does exactly this, projects to the sideline and actually can show you real-time data on an iPad. I presume this is along those lines, as you said.
Is it the same?
I could find the maker for you if you'd like. They've been looking there for about the last year.
I know Cleveland Clinic, I think, was interested in it, and
I know that it was either there was a few Big Ten schools in Notre Dame. So.
Was this thing built in-house, do you think, or did they buy it from somebody?
I think they designed it. Yeah, and they would be willing to supply the boxers with the mouthpiece, with the technology.
Does it fit as well as a regular one?
I assume it does. I can't be certain.
Is this part of a research protocol or an investigational device, or?
If it was used, it would be part of a research protocol.
I mean, the reason I ask about the investigational device is that, even some of the sideline concussion assessments are now being considered under the FDA for being a medical device for return to play strategies. I don't know if these kind of things come under a special caveat or under any regulation at present, but it might be worthwhile taking that back to them and asking them.
Mm-hmm.
Part of this, I think, relates to a lot of the increased awareness in the lay press and public about concussions.
So anyone has any other comments about the mouthpiece? Whether you think it might be worthwhile to pursue this?
Is I'm sorry, I don't have a chance to see it. I'm just curious if the device is completely self-contained, has no protruding metal or wires or anything else on it. And
Yeah, it's totally self-contained. Yeah, there's no sharp edges.
It's the same size as a regular one?
Yes. Yes.
It sounds pretty interesting.
Said Dr. Mirabelli.
I guess my question is, what are we going to do, or what are they going to do with the information that they're collecting?
I would guess probably document concussion and exposure.
Forces, at least.
Yeah.
I guess we're not going to know when concussion occurs aside from knockouts. But
Yeah. One of the I think advantages to having a mouthpiece versus what the football players are using in the helmet, I think there's some question as to how accurate the accelerometers are in the helmet, because the helmet moves, and so I don't think it's as accurate in terms of really measuring the forces.
You mean the helmet can move without really the head moving?
Yeah. Okay. Any other comments on the mouthpiece? Do you think we should pursue this at all, or think it might be?
Do you think there'd be any pushback from the boxers?
Well, it'd be voluntary. I mean,
Right.
we can't.
I mean, are they willing to do it, or do you
There
think?
might be some. I don't know.
They're generally pretty
It won't affect.
accommodating.
Yeah.
They like to think that they're helping with any kind of medical research, and I think they would
Yeah, if
have
it
a
fits
fair
right.
amount.
Yeah.
If it fits right. then
Yeah, if it's
sure.
right. And the other thing, if it's not going to affect whether we allow them to box or not. So they probably wouldn't mind from that standpoint.
I guess, Barry, one question I had in advance of this meeting is, what is the approach of the active and retired boxing community for work like this? There's a lot of interest from football, for instance, in the NHL and into these kind of things. I mean, do we begin to open ourselves up to liability if we have data that's out there that's potentially dangerous for these players and we don't act on it or doing anything else other than recording it?
I'm not sure if I understand the question.
Well, if we know, for instance, that I guess maybe you could help us out here, help me out, because I mean it's a different perspective from combat sports versus other non-combat sports where the objectives are different. Obviously, I presume the boxers know a certain in advance what risks they're putting themselves in here versus football players where it's become a bit of a surprise that this is not something they were expecting. I mean, there's a great sense of litigation among football players. Is that same sense there in boxing that we need to be aware of, or is this a different approach, a different awareness?
That's a good question. I don't think it's a similar situation. I think most boxers are aware of the risks of the sport.
And this is just to accumulate data. I mean, nobody's going to look at the screen and say, oh, he's concussed, because nobody knows the relationship.
Right,
I think
right.
you have to take the measurements and then do the usual test for concussion and then see how they match.
I totally agree. I think what we're doing is recording data, not necessarily acting upon it because we don't have the clinical outcome.
No, not at all. I wouldn't. I think you have to act on standards we have now.
The reason I ask is because there are these very substantial lawsuits that are coming to bear in the NFL. $765 million last week from the NFL was paid out, and a lot of it is there's these kind of accusations that are coming about that there's data out there that the NFL didn't act upon in the interest of the player. My only concern about this, and I think this is great for progress in the sport, but do we open ourselves up to a liability?
No. I don't think we do, simply because if you look at the accelerometer data with the football helmets, there's no established concussion threshold for linear or rotational acceleration. You may have one athlete that has a 100G hit and it's fine. You have another athlete that has a 40G hit and has a concussion. So it's really not that simple. I suspect that part of it may be secondary to the individual's vulnerability, and also the angle at which the acceleration or the hit occurs. I think it's a lot more complicated than we think it is, and so I don't think anything is really firmly established that would suggest, this individual had a blow delivered to the head of 120 Gs, and therefore we neglected that, and there's a problem. I don't think the science is there yet.
Yeah, 5 years it might be.
This will maybe help us get there, making these players safeguarded.
What's interesting about this accelerometer, it apparently is very safe. I've heard some other stories where different brand accelerometers where there's actually like either shocks or maybe like sparks coming out. It wouldn't be too good. Okay. So let's move on and discuss new business or have an open discussion. One of the things I wanted to mention, one of the things we're starting to pilot is using the King-Devick test. It's a screening test which assists in helping you determine if an athlete has sustained a concussion. And I want to emphasize it assists because the diagnosis of concussion is a clinical diagnosis. There's no device, there's no test that's going to tell you if an individual has a concussion. So that's the reason why we're piloting it, just to see if it provides any additional information. And basically, it's a test where the individual is required to read numbers across the card as fast as they can and make the minimum amount of errors. So the first card is a test card where you explain to them, you start from the left, go to the right, and go to the next line. And you have to go as fast as you can and as accurate as you can. So then there's 3 cards that they read, and it's timed. And so in each card, each test is a little more difficult than the previous one. So this is test number 1, and then you have test number 2, and then you have test number 3. Number 3 is a little more difficult. And then you add up the total time for all 3 cards, and you add up the total number of errors. And what we've been doing is that we apply this test at the weigh-in the night before the fight, and then we have one of our physicians retest them after the fight. Again, this is very preliminary. We may have data right now in about 60 boxers, maybe. And we're going to see if it actually adds anything to our assessment. It's not going to replace, obviously, our exam, but if it's a tool that can assist us in picking up a concussion, then that might be worthwhile. Just anecdotally, from our experience so far, mostly all the boxers do better on the follow-up. There have been some boxers that have been concussed, and we did see a delay in the timing and the increased number of errors. That's one thing that also seems to be consistent on the follow-up. They seem to make more errors. But again, we have to look at the data and see if this is worthwhile. And also, it doesn't seem like there isn't any correlation between a boxer that loses and their score. So we need to look at the data in more detail. I guess it's also important to emphasize that if a boxer does experience a TKO or a KO, TKO in particular, it doesn't necessarily mean they had a concussion. Basically, it means that the referee stopped the fight or the physician stopped the fight, but they may not have had a concussion. But also, if they didn't have a TKO or KO, that doesn't mean they didn't have a concussion either. So we had one boxer who I think lost by a decision, and you could see that his score was a little slower on follow-up. So we've been implementing this, and it seems like it's doable. That was the other reason to pilot it, because we weren't sure if it was feasible to try and do it at the weigh-in or at the time of the fight. So, but the boxers have been willing to perform the test.
It's like 2 minutes long, right? Something like
Yeah,
that.
it's very short. It takes no time at all.
I think it's great you're doing this, Barry. I think you've alluded to, there's really no data in boxing about this right now that I know.
Right, there was one
MMA.
one study looking at it. It was boxers and MMA, Steve Galetta and his group.
Right.
Yeah. Any comments on the King Devick test? Or?
Where did it come from? Who developed the test?
This was developed by an optometrist. Initially, it was not for concussion. I don't recall. I want to say, I'm not sure what the original indication was, but it wasn't for concussion.
Reading disorders, visual tracking problems.
Right, okay.
Yeah, it's not a new test, but it's
Right.
being newly applied into the realm of sports. It got a lot of traction. Steve Galetta is the name you mentioned. He was a prominent neurologist at the University of Pennsylvania, was actually doing these on most of the football players there, and recently just transitioned. He's now the chair at NYU, and he's doing them. I'm not sure on what team, still working with the Penn players, but he has an interest in expanding it, and he did the MMA study.
Right. Right. So, I'm sorry.
I was just going to comment. I don't know if any of you have had a chance to use it. I was using this test on the sideline this year. Major League Lacrosse has designated that along with a variety of other sideline tests that they asked their team physicians to use this year. Chris Nowinski in the Sports Legacy Institute was the consult on MLL's concussion policy, and that was one of the recommended tests. So we used it for the first time this season. I didn't end up needing to use it more than twice. I don't know how much extra it really lent to me as far as additional information. I probably wouldn't have. I don't think it changed my mind about anything that I saw, but I only used it on 2 separate occasions.
Right.
It is a bit time-consuming. At least the way MLL used it is it required a baseline test, and then you compared them against that. So basically, all the fighters would need to have that done for them, in their preseason or their pre-fight physicals, and we would compare it against them presumably after the fight, because I imagine it'd be too difficult to do between rounds.
Right. No, you can't do it between rounds. Can you just identify who's speaking just now?
Who was using it?
No,
I'm
who's
sorry.
speaking?
This is Mark Novelli from Rochester.
Okay.
I'm sorry. No, this is Mark Novelli from Rochester.
Okay. And along the same lines, one of the other tests that we use as part of the annual examination, we use the SAC, Standardized Assessment of Concussion, just as sort of a baseline. It has come up in the past whether we should do the SAC after the fight also. I'm not sure if it's feasible yet in terms of the time it requires. That's something we have to look at in some detail. Okay. Any other comments on the King Devic or SAC? If not, then we can move forward. The other issue that came up during the last meeting was the development of educational pamphlets and information be put on the website of the New York State Athletic Commission for boxers and for the public. We did put on the website.
Yeah, I think we put
Dehydration.
the dehydration chart, did we? Okay, so we didn't do the dehydration chart, but we do have a very good dehydration indicator. It's a color indicator, a urine color indicator, which is quite nice, quite interesting. The one that we did put up
Concussion.
the concussion. Yeah, we put up a concussion one, but we need more. Things like MRSA, steroids, and the use of the effects on the body physically. Fighters need to know these things. There are a lot of little things, small things that the fighters need to be able to read in lay terms that they and their trainers in their camps can read and understand. So those are the kinds of things that we're asking for. That we can post and put on our website so you can have access to it.
What do you think about those posters that were co-developed by the NFL and the CDC about recognizing concussion? They went up in the locker rooms of every.
Those we actually had those, but they didn't really pertain to boxing.
Right.
It was specific to.
Right.
But I mean, maybe adapting something like that. I mean, it was.
Absolutely.
Yeah.
Absolutely. Things like that. Things that we can post, because if we had things like that, we would send them around to all of our licensed established gyms.
Yeah, I mean, it may not be worthwhile trying to reinvent the wheel here. Maybe look at what other sports and maybe other states have done as far as educational materials.
Yeah, the CDC has been very much involved with this educational program for concussion.
Heads up.
And most of the posters that are out there have been in conjunction with the CDC and some other organization. So I don't know if that might be one avenue.
Actually, the cards that you made up years ago are still quite nice. I think they're very appropriate. I think we should relook at them.
Right, I think that's a good point. We had devised head injury cards that just listed symptoms. If you have these symptoms, go to the emergency room and also contact the commission. I think that's important for us to re-implement. Because a lot of times some of these athletes don't know what to look for after they had a competitive bout. Okay. Anything else regarding that?
No, that was it.
Okay. Another thing I wanted to address, I guess it must have been probably at least 2 years ago, the commission had adopted a policy regarding knee braces in the ring. And the commission had adopted the approach that a boxer should not get in the ring with a knee brace. I think the reason why this came about, there was a competition where a boxer had a knee problem, hurt his knee. And I'm not sure if he was wearing a brace at the time, but
No.
he wasn't wearing a brace at the time. But we do have sometimes boxers
He had a brace at the, I think he wore the brace at
The weigh-in.
the weigh-in.
Mm-hmm. All right. Does anyone have any opinions about a boxer wearing a brace during the competition?
The basic concept with fighters being equality. So you keep that in mind.
So what's been the concern with wearing a brace? Is it more for the opponent or more for the person wearing? I mean, in terms of...
I think it's more for the person wearing it. I think at least what I gather, I wasn't here when this policy was adapted, but I gather it was felt that if their knee was troublesome to the extent they needed to wear a brace, then they weren't 100% to compete.
That was part of it. I remember some of these discussions. That was the first part of it. The second was depending on the type of brace during like a close fighting, depending on the type of the brace, it might injure the opponent. Mm-hmm. And so coupled with those two factors, there was a determination that the fighter may not be medically fit to compete, and therefore an application for licensure should be denied, or if the fighter is actually licensed, the fighter should be placed on medical suspension, and also the rest of the other fighter, depending on how close they get, the type of the brace.
And there were also, I think, a couple of cases where the boxer did not present with the brace at the weigh-in, and then in the ring they show up with full brace. In one case, metal.
I mean, maybe the orthopedist in the room can comment, but I don't think a brace would necessarily give somebody a competitive edge.
No, I don't think it would give them an edge either.
Right. I mean, a normal knee is not going to be further strengthened necessarily by a brace, but I think the risks of injury and then the suitability to box, I think those are appropriate concerns.
Right. Mm-hmm. But I at least a few instances recently that have come up, we've had boxers just have a sleeve, and that won't injure the other opponent. And how much protection you think a sleeve is going to afford anyway?
None.
Yeah.
But it's not problematic. I mean,
psychotherapy.
It seems like to me that the ace in the hole is the ringside physician. If somebody's out there and they're not moving well and they're not, then I think it's a responsibility of the ringside physician to more recognize that and stop the bout, as opposed to categorically saying you can't wear something. It's not. I mean, I think probably more the issue tends to be is more as the brace appropriately padded and protected more for what I think the opponent, especially in an MMA type of stuff and close contact. So, I mean, it just doesn't seem like. It's like, so if their knee is bad and they wear a brace or don't wear a brace, their knee's still bad. And so I think it's imperative that the ringside physician is one that recognizes this person isn't able to protect themselves whether they have a brace on or not.
Right. I agree with that. I think that's a good point.
Also, I think that the fighter should has a responsibility during the pre-fight physical to let the doctor know, because some of these fighters won't let them know that I have a bad knee and I need to wear something to either mentally support me or physically support me. Mm-hmm. And then the day of the fight, they show up with the brace and it throws everything off. So we don't know because they haven't given us accuracy as far as their physical condition. In one case, particularly, we had where his knee was injured. I mean, it was really injured, and it just exacerbated the situation when he got into the ring because he hadn't disclosed.
But that same guy, if he would have, if he tries to box without a brace, he still is equally or maybe more so in jeopardy. So it's not like
he's in jeopardy, but then the commission then
I don't think the brace should
assume the
take them out. It's
responsibility.
more like
Right.
this guy's not capable. He should be out. It doesn't matter
Exactly.
whether he's
There's a
got
brace or not.
tape, brace, what have you. But
Right.
Well-
So I think I would ask the medical advisory board maybe to make a recommendation. Instead of having a blanket statement stating if you have a knee brace you can't fight or you can't fight with a brace, I think maybe a statement could be made where you allow it to be determined on a case-by-case basis at the discretion of the ringside physician whether the brace can potentially harm the opponent and also whether the boxer's knee is strong enough or fit enough to be competing. I don't know what people's thoughts are about that.
it seems like it should be in the hands of the ringside physician. I mean, so at the NFL, a lot of the bracing and casting is there's certain guidelines that the officials have. So the officials are really kind of passing, in the NCAA, it's 2 inches of foam, all this first. So it's really the officials that are really responsible for allowing it to happen or not.
Mm-hmm.
These fighters, are they required to disclose?
Yes.
They are.
Yes.
If any surgeries or anything,
Yeah,
they
we
have
have
to
a-
disclose that.
Yeah, we have a very detailed annual physical would have to disclose all medical information, basically.
So is there a problem if they don't? Like if they didn't tell you, is there some sort of thing they sign saying that I kind of attest that I don't have this, and then they...
When they submit the application requires them to affirm that they've read all the commission's rules, the statutes, regulations, and that all the information that they're providing to the commission is true and accurate. So if it turns out that a boxer intentionally withheld the information, as an administrative remedy, we could suspend or revoke or try to fine the licensee. But one of the concerns that I would have is whether or not we know if any other states permit braces before the MAB sort of determines that they're going to revisit their, existing policy on the braces. I mean, do we know if other states permit them? If the fighter is wearing a brace, does that mean that they're then, fit enough to box or not? Because if the knee is so injured that they have to wear the brace and the brace isn't going to help them, what's the point of allowing the fighter to have the brace and allow them into the ring? So just as a recommendation, before the commission decides to change their policy, I think that a little bit
I think that
more
was
research is
part
probably
of the
into it.
reason that the last policy was adopted.
Which was
And keep in mind that boxing and MMA, really are two different sports. So can't compare one.
well, no, I mean other states permit it.
Yeah,
with
no,
respect
I
to
think
boxing.
they would lean towards not permitting the braces. I know I've spoken with Vegas.
So Kaiser.
They allow braces?
No.
Okay.
Well, that's the way I would lean, is against braces.
Yeah.
Right. How about a sleeve, though?
Well, that's just like an elastic
Yeah.
ankle brace.
Yeah.
I don't see any real problem with a sleeve, but
Having spent my Saturday at Dick's Sporting Goods looking for an elbow pad for my son on Saturday, I think it's a slippery slope between sleeve and brace and pad, and I think you just have to make a decision about anything on the joint. I don't see if is there even a reason why somebody would even wear a sleeve other than what you're alluding to than
I
Dumbo's
think
magic
it's
feather.
psychotherapy.
Right,
Yeah.
it's Dumbo's magic feather at some point. So.
Yeah. I mean, the sleeves don't really provide any joint, support.
Right.
I mean, it's not a structural thing. I mean,
Yeah.
if it needs structural support, then it's a different type of brace,
Yeah.
or it's a hinge.
Mhm.
There's some sort of rigidity to it.
Yeah.
So
I don't think we've had any boxers try to really
They've tried.
with a yeah.
Yeah.
This
brace.
can't be a major problem.
Yeah, no. With the policy in effect, there's been less boxers to try it because we can just say no.
Like at some point, they're going to say, well, if I can wear it on my knee, but can I wear it on my elbow, my
Exactly.
forearm? Then that actually could provide a competitive edge
Exactly.
if there's a worry for abrasion and so forth.
Okay, so I guess what I'm gathering, whether it's a brace or a sleeve, they shouldn't compete. Is that what I'm gathering?
Sounds good to me.
Okay. Alrighty.
But
That's
they can have an ankle brace.
Or a big toe brace.
An ankle brace.
or for that matter, can they tape
With a
their
charm
ankles?
on it.
That's
What's
it's the
that
same
mean?
thing, you know. I mean, I think I'd rather not get into that. I think.
No, I just.
All right, that's it in terms of any new business I wanted to discuss. Anyone have any other topics they might want to discuss? No. Okay, so I make a motion that we adjourn the meeting.
So moved.
Okay.
Before we
Or something. Second.
do you want to maybe see if we can find a new date so that
For the
for
next meeting.
For the next meeting,
Okay.
see what's available and choose
Well, this is
a couple of
September.
dates and
I
then-
guess the question is, should we do it before the end of the year or do it in January?
Is the intention quarterly or semi-annual? What's the...
It varies depending upon what needs to be discussed. September, so October, November, December.
I would think January.
I would think January. Usually that's a good time for us to. You typically usually meet in January anyway.
throw out a couple of
Yeah.
dates and
So I
And
think
everyone
Wednesdays
can-
tend to be the best day. So 15th or the 22nd of January. Or the 8th might work.
okay. And whichever works for everybody, just
All work for me.
let us know.
There are two doctors on the phone. Any dates that work for you or don't work?
For me, you're talking either, it's got to be a Wednesday though, and it's either the 15th or 22nd of January is the best two options.
Or 8.
Or the 8th, yeah. Wednesdays tend to be the better day.
I think for me, take a look at my calendar here again. Yeah, the 15th or the 8th would be better than the 22nd for me.
Okay. So do you want to do tentatively the 15th? We'll do, and then see how that works. Okay.
And Mark, I will send you a photo of this accelerator, okay?
I'd love to see it. Thank
The mouthpiece. I'll send you a couple of photos from different angles so you'll see what it looks like.
you.
Sure.
Okay. So I guess we can adjourn the meeting.
Now, is there a second to
Second.
adjourn?
Davis,
Second.
second. All in favor?
Aye.
Okay. Opposed?
Aye.
Okay.